Around 50% of older adults admitted to hospitals are already malnourished when they arrive. Your body doesn't wait until you're in crisis to ask for help. It whispers first. It sends small signals, quiet messages that most people dismiss as normal aging. But here's what doctors know and most people don't. Many of the symptoms you think are just part of getting older are actually your body screaming for specific nutrients it desperately needs. That cramping in your legs at 3 a.m., that's not just age. The numbness in your fingers that you've been ignoring, that's not just circulation. Those bruises appearing on your arms that you can't remember getting, your body is speaking a language, and today I'm going to teach you how to understand it. I've studied both modern medical research and traditional wellness wisdom, and one truth connects them both. Your body never lies. When something is missing inside, it shows up outside. The National Institutes of Health and Harvard Medical School confirm this. Your skin, nails, tongue, and muscles act as mirrors reflecting your internal health. Today, I'll walk you through 7 warning signs that appear in people over 60, what each one means, and exactly how to address it before a small deficiency becomes a serious health crisis. If you're over 60 or care for someone who is, the next 15 minutes could be life-changing. Let's start with warning sign number 1, nighttime leg cramps. You wake up at 2 a.m. with a violent muscle spasm in your calf. The pain is so intense, you can barely breathe. You try to stretch it out, massage it, walk it off. Finally, after several agonizing minutes, it releases. This isn't random. Research published in the American Family Physician Journal shows that up to 60% of adults over 60 experience nocturnal leg cramps, and most cases point to 3 key deficiencies: magnesium, potassium, and calcium. Here's why this matters. Magnesium is essential for muscle relaxation. When magnesium levels drop, your muscles can't release properly after contracting. They lock up. Studies in the Journal of the American Geriatric Society found that magnesium supplementation reduced the frequency and intensity of leg cramps in older adults by up to 78% within 4 weeks. Potassium works alongside sodium to regulate nerve signals and muscle contractions. When potassium falls too low, your nerves misfire, sending incorrect signals to your muscles. The result is sudden, painful cramps. Calcium, meanwhile, is critical for muscle contraction itself. Without adequate calcium, your muscles can't function smoothly. If you experience frequent leg cramps, especially at night, consider these steps. First, increase magnesium-rich foods: leafy greens, almonds, avocados, and dark chocolate. Second, eat more potassium: bananas, sweet potatoes, spinach, and beans. Third, if dietary changes aren't enough, doctors often recommend magnesium glycinate supplements at 300 to 400 milligrams daily, taken in the evening. Always consult your doctor before starting supplements, especially if you take medications or have kidney issues. Warning sign number 2, tingling or numbness in hands and feet. You're sitting on the couch and suddenly your toes feel like they're asleep, or you wake up and your fingers are numb. You shake your hands, the sensation comes back, and you dismiss it. But when this happens repeatedly, it's not just poor circulation. According to research from Johns Hopkins Medicine and the National Institute of Neurological Disorders, persistent tingling and numbness, especially in a symmetrical pattern affecting both sides of your body, often signals B12 or B6 deficiency. Vitamin B12 is essential for maintaining the protective coating around your nerves called the myelin sheath. Think of myelin like insulation around electrical wires. When B12 drops, that insulation breaks down. Nerve signals get disrupted. You feel tingling, numbness, or burning sensations, usually starting in your feet and hands. Studies show that up to 20% of people over 60 have B12 deficiency, often because aging reduces stomach acid production needed to absorb B12 from food. Vitamin B6 also plays a crucial role in nerve health and neurotransmitter production. However, too little or too much B6 can cause nerve problems, so balance is key. If you notice persistent tingling or numbness, ask your doctor for blood tests measuring B12 and B6 levels. If B12 is low, you may need sublingual supplements that dissolve under your tongue, B12 injections, or high-dose oral supplements, usually around 1,000 micrograms daily, include B12-rich foods, eggs, dairy, fish, and fortified cereals. For B6, eat chickpeas, bananas, potatoes, and poultry. One critical point: if you're diabetic, numbness in your feet could also indicate diabetic neuropathy, which requires immediate medical attention. Don't guess. Get tested. Warning sign number 3, bleeding gums when brushing. Every time you brush your teeth, you see pink in the sink. You think, I just brushed too hard. But healthy gums don't bleed easily. Research published in Nutrition Reviews and by Harvard Health reveals a clear connection between bleeding gums and vitamin C deficiency. Scientists examined data from over 8,000 people in the CDC's Health and Nutrition Examination Survey. Their finding, low vitamin C levels in the bloodstream were strongly associated with increased risk of gum bleeding. When people increased vitamin C intake, bleeding often stopped within weeks. Vitamin C is essential for collagen production. Collagen is the protein that holds your blood vessels together and keeps your gums strong and resilient. When vitamin C drops, the tiny capillaries in your gums become fragile. They break easily. You see blood. Studies from the University of Washington School of Public Health confirm that bleeding gums should prompt you to investigate vitamin C status as one possible cause. Here's something many people miss. If you eat a lot of sugar, your body struggles to absorb vitamin C. Sugar and vitamin C have similar molecular structures. They compete for absorption in your intestines. One blocks the other. So even if you eat vitamin C-rich foods, high sugar intake can leave you deficient. What to do? First, reduce sugar and processed foods. Second, increase fresh vitamin C-rich foods, bell peppers, strawberries, oranges, kiwis, broccoli, and tomatoes. Third, medical professionals often recommend vitamin C supplements at 500 to 1,000 milligrams daily. If bleeding gums persist after improving vitamin C intake, see a dentist. Gum disease is serious and can lead to tooth loss and even increase heart disease risk. But often, the solution starts with a simple vitamin. Warning sign number 4, confusion, memory problems, or brain fog. You walk into a room and forget why you went there. You lose your train of thought mid-sentence. You feel like your brain is wrapped in cotton. For people over 60, this is the symptom that causes the most fear. Is it dementia? Is it Alzheimer's? Sometimes it's neither. Research from the Mayo Clinic and published in the Journal of the American Geriatric Society shows that vitamin B12 and B1 deficiencies can mimic dementia symptoms, causing memory loss, confusion, difficulty concentrating, and personality changes. Here's the critical part. These symptoms are reversible when caught early and treated properly. Vitamin B12 deficiency affects brain function in multiple ways. B12 is essential for producing myelin, the protective coating around brain cells and nerve fibers. Without adequate B12, brain signals slow down, cognitive function declines. Studies show that seniors with low B12 levels score significantly worse on memory tests compared to those with healthy levels. When B12 is restored, cognitive function often improves dramatically. Vitamin B1, or thiamine, is equally important. Thiamine is critical for glucose metabolism in the brain. Your brain relies almost entirely on glucose for energy. When thiamine levels drop, your brain can't produce enough energy to function properly. The result is confusion, poor concentration, and memory problems. Thiamine deficiency, though less common, can occur in people who drink alcohol regularly, have poor diets, or take certain medications like diuretics. If you're experiencing cognitive changes, don't panic, but don't ignore them either. Ask your doctor for comprehensive blood work including B12, folate, and thiamine levels. Thyroid function should also be checked, as thyroid disorders can cause similar symptoms. If B12 is low, treatment typically involves high-dose supplements or injections. For thiamine, supplementation and dietary improvements usually resolve symptoms quickly. Include B12-rich foods like fish, eggs, dairy, and fortified cereals. For B1, eat whole grains, legumes, nuts, and pork. The key message: Cognitive decline isn't always dementia. Sometimes it's a vitamin deficiency that can be fixed. Warning sign number 5. Easy bruising without injury. You notice a large purple bruise on your arm. You have no memory of bumping into anything. A few days later, another bruise appears on your leg. Your skin seems to bruise from the slightest touch. This is common in older adults, but it's not normal. According to Cleveland Clinic and research in the American Journal of Clinical Nutrition, easy bruising often signals deficiencies in vitamin C, vitamin K, or both. Vitamin C, as mentioned earlier, is essential for collagen production. Collagen strengthens blood vessel walls. When vitamin C is low, capillaries become weak and fragile. They rupture easily, even from minor pressure, causing bruises to appear. Vitamin K plays a different but equally important role. Vitamin K is essential for blood clotting. When vitamin K levels drop, your blood doesn't clot efficiently. Even small breaks in capillaries lead to more extensive bleeding under the skin, creating larger, darker bruises. Studies show that vitamin K deficiency is relatively common in older adults, especially those taking antibiotics long-term, those with digestive disorders affecting fat absorption, or those on blood-thinning medications. If you bruise easily, first assess your vitamin C intake. Increase foods rich in vitamin C, citrus fruits, berries, peppers, and leafy greens. For vitamin K, eat more leafy greens like kale, spinach, and collard greens, as well as broccoli and Brussels sprouts. However, if you take blood thinners like warfarin, do not increase vitamin K intake without consulting your doctor, as vitamin K can interfere with these medications. Also, if bruising is severe, sudden, or accompanied by other symptoms like fatigue or frequent infections, see a doctor immediately to rule out more serious conditions. Warning sign number 6. Vertical ridges on your nails. Run your finger across your thumbnail. Do you feel raised lines running from the base to the tip? These vertical ridges are incredibly common in people over 60, and most doctors dismiss them as harmless signs of aging. But research published in the Indian Journal of Dermatology and by Cleveland Clinic suggests these ridges can indicate iron deficiency, vitamin B12 deficiency, or biotin deficiency. Iron carries oxygen to every cell in your body, including the cells that build your nails. Without adequate iron, nail production slows. Nails become weak, brittle, and develop vertical ridges. Iron deficiency is the most common nutritional deficiency worldwide, especially in older women. Beyond nail changes, iron deficiency causes fatigue, weakness, pale skin, and shortness of breath. Vitamin B12 deficiency also affects nail health. B12 is essential for red blood cell production and rapid cell division. Your nails are made of fast-growing cells. When B12 drops, nail growth slows and abnormalities appear, including ridges or darkened pigmentation. Biotin, or vitamin B7, is essential for keratin production. Keratin is the protein that makes up your nails, hair, and skin. Research shows that biotin supplementation can improve nail thickness and reduce brittleness by up to 25% in people with biotin deficiency. If you notice pronounced vertical nail ridges, don't guess which nutrient you're missing. Ask your doctor for blood tests, checking iron levels, B12, and if possible, biotin. Based on results, supplement wisely. For biotin, doctors typically recommend 2,500 to 5,000 micrograms daily, which is safe and effective. Iron should only be supplemented if tests confirm deficiency, as excess iron can be harmful. Take iron with vitamin C to enhance absorption. Include nutrient-rich foods, eggs and almonds for biotin, spinach and lentils for iron, and animal products for B12. Warning sign number 7. Slow wound healing. You get a small cut on your hand. Normally, it would heal in a few days, but 2 weeks later, it's still there, red and slow to close. Or you have a minor scrape on your leg that seems to linger for weeks. Slow wound healing is particularly concerning for seniors because it increases infection risk and can signal multiple nutritional deficiencies, especially zinc, vitamin C, and protein. Zinc is absolutely critical for wound healing. Research published in the journal Nutrients shows that zinc is involved in every phase of the healing process: inflammation, new tissue formation, and remodeling. Zinc deficiency impairs immune function, slows cell division, and weakens collagen synthesis. Studies show that zinc supplementation significantly speeds healing in people with low zinc levels. Signs of zinc deficiency include slow healing cuts, frequent infections, hair thinning, and loss of taste or smell. Vitamin C, as discussed, is essential for collagen production. Collagen is the main structural protein in skin and connective tissue. Without enough vitamin C, your body simply cannot build new tissue to close wounds. Protein is equally important. Your body needs amino acids from protein to repair damaged tissue and create new cells. Older adults often don't eat enough protein, leading to slow healing and muscle loss. If you notice wounds healing slowly, take action. First, ensure adequate protein intake. Aim for at least 0.8 grams of protein per kilogram of body weight daily, more if you're active or recovering from illness. Include lean meats, fish, eggs, dairy, legumes, and nuts. Second, increase zinc-rich foods: pumpkin seeds, chickpeas, cashews, and oysters. Doctors often recommend zinc supplementation at 30 to 35 milligrams daily for 4 to 6 weeks, always taken with food. Third, boost vitamin C intake as previously discussed. If you're diabetic, slow wound healing is especially concerning and requires medical attention. High blood sugar impairs circulation and immune function, making wounds dangerous. Don't wait. See your doctor. Now, if you want to get high-quality supplements from manufacturers that meet strict quality standards, I've put links in the description below. These are brands that have been tested for purity and potency. Your body is not your enemy. It's your most faithful ally. It wants you healthy and strong, and it will warn you, sometimes weeks, sometimes months, before small problems become big ones. These aren't random symptoms. These aren't just aging. These are intelligent messages from an intelligent system. If this information helped you, subscribe to this channel and share this video with someone who needs to hear it. Your body has been speaking to you. Today, you finally listened. Thanks for watching and stay healthy.